coughing on water, pills feeling stuck, drooling, or meals taking a long time. If you or your loved one have Parkinson's disease, this video is for you.
Speech secrets.
Swallowing problems or dysphagia is a common symptom for people with Parkinson's. I'm going to help you understand what causes it, how to help, and how to advocate for the right support. Let's get started. Parkinson's is most common with older adults with average age of onset in the early to mid-60s. There's over 10 million people worldwide with Parkinson's disease, and many don't receive speech therapy despite problems with speech and swallowing. Parkinson's is caused by a deterioration of brain cells responsible for making dopamine. Dopamine supports our body in creating smooth, coordinated movements. That's why common symptoms include rigidity, tremor, slower movements, or difficulty walking. So why is swallowing a Parkinson's issue? Here's the key idea. Parkinson's makes automatic movements harder. Automatic movements are things your body normally does without thinking about them, like talking or swinging your arms while you walk and swallowing. In Parkinson's, that automatic system becomes less reliable because it's highly dependent on dopamine. And that's why speech therapy for this population focuses on shifting speech and swallowing from an automatic function to a more intentional function. Swallowing changes can happen in early or later stages of Parkinson's. Common signs include coughing or throat clearing with food or drinking, residue in the mouth after eating, not chewing efficiently or taking longer to chew, a wet or gurgly voice after swallowing, food feeling stuck, unintentional weight loss, repeated chest infections, and drooling. Side note on drooling, it's caused by not swallowing frequently enough, not an increase in saliva production. But here's something tricky. People with Parkinson's aren't always aware of their changes in their speech and swallowing. We know that Parkinson's can affect one's own sensory perception and self-monitoring. So it's not necessarily denial or stubbornness. It can actually be part of the disease. So what does speech therapy do? Well, swallowing treatment usually falls into two different categories: compensation and rehabilitation. Compensation means changing how or what you eat to reduce risk. Examples include sitting upright when you're eating, slowing down the rate at which you're taking bites, alternating liquids and solids to help clear residue in the mouth or in the throat between swallows. Other examples of compensation would be changing textures of food. If somebody's having difficulty with chewing, then selecting foods that require less chewing and form cohesion a little bit easier. Using compensatory strategies requires a certain level of cognitive awareness. And if a person struggles with insight or being able to focus during a meal, then using compensatory strategies is often reliant on a caregiver. So much info, so little time. Where do we go? Before we move on to the rehabilitation approaches, come here, I got a secret. Like and subscribe. Not going to find this information anywhere else. Actually, that's not true. It's available lots of other places, but not in this format. The second approach uses exercise to build and maintain strength and coordination to support airway protection. When I say airway protection, I'm just talking about your body's ability to clear food or liquid out of your windpipe should it go down the wrong tube. There's some evidence around swallow rehabilitation exercises for this population, like the effortful swallow or tongue exercises, if done consistently as a home exercise program. But in Parkinson's, we also pay attention to cough strength, coughing coordination, and voice because these systems also protect the airway. If something goes down the wrong tube, then your body needs strong defenses to be able to clear it. Speak Out and Lee Silverman Voice Treatment Program are both therapies to help strengthen the voice and speak loudly. Having a strong voice is good for airway protection. LSVT also did a pilot study showing some benefit to swallow measures. Speak Out also integrates swallowing with intent into their therapies. I'm a certified Speak Out provider, and I really love their program. Another exercise approach I want to mention is respiratory muscle strength training. specifically EMST. Actually, I just made a video on this topic. Drop down, please. EMST helps build a stronger cough to support safer swallowing. This approach even has some secondary benefit, improving your hyolaryngeal function or how your swallow muscles lift to protect the airway. This video was actually inspired by a question I got about Parkinson's and swallowing, so please leave a comment. Let me know what subjects you'd like to hear. If swallowing feels or seems different with Parkinson's, then bring it up to your physician early on. This issue is often under-identified, and it's much easier to build habits and exercises early on. Ask for a referral to a speech therapist for a swallowing evaluation or a swallow study. It's not uncommon to require reassessments of swallowing as the condition changes. The goal is long-term management plan that keeps eating and drinking safe and comfortable. Thanks for watching, and be kind to yourself.